Hello, everybody. Just waiting. To get my glasses.
Hi, good to see you. It's
You
been such
too.
a while. Oh my
I
goodness, how?
know. I'm good. Are you using your phone? I think you might have to clean the camera.
Oh, okay, it's not clear. Oh, I see.
Yes,
I can do that. Is it better?
much better.
Okay,
How now?
I'm well. Are you excited about today's topic?
Am I? I don't even know. Where is everybody now? I'm I'm wondering where we're going to end up, to be honest.
Well, let's see.
Yeah, let's see. I hope nobody calls me on my phone.
Oh, I
Okay.
see. Okay, this is Johnny. Someone has joined.
Yes, someone has joined. Hello, Akimade.
Welcome, Akim.
Welcome, welcome, welcome. We're just waiting for more people to join us and then we'll start.
Yeah. Should I play my
We're doing
music?
we're doing Nigerian time. Sorry?
Okay. So you can hear some, I'm playing some music. Maybe you'd hear it.
Okay. Akim is my friend, don't mind him, so we can keep gisting.
No, we shouldn't because, the light would be, when you record it at the end, it'd be
I'm sure
everything
they
that
can. No, she can
edited, right?
cut it. Yeah,
Alright.
I'm sure.
I like the color of your
Um,
hair.
Thank you. I know, right? I thought I would do something post-COVID. Is it post-COVID now or pre-COVID now? During COVID.
I missed COVID. I missed.
I'm amidst COVID, yes. Where are all the people now? Okay, it's only 1 minute past 7.
Yeah, we were bang on the time.
Yeah. I actually turned off my phone to conserve battery.
Okay.
And then I
Let
just
me.
remembered. I thought the backward that it was 5 minutes to 7.
Okay, more people have joined.
Yeah. Hello, follow me. These are all the Healthboxes people.
Oh, okay.
We just wait
City
for
Web
some more
is
people.
coming.
Sorry?
I see City Web.
Yes. These are all our people. And hi, Roke. Hi, Priscilla.
Hello, everybody.
Hello, hello, hello. So I think we'll start at 7:05.
Okay.
I think.
So what's the time now? How many more minutes do we have? Okay.
2 more minutes.
2 more minutes. Okay, let me do something else while I wait.
Oh, wow. Okay. New Win has joined. Hello.
Hi. Hi,
Hi,
New
New
Zealand.
Win.
Good to have you.
It's great to have you. I'm not sure. Would it be Augusta? Do you know?
Yes, yes, most likely. Hello. Hello, Miss Polami. Um,
That's Roke.
okay, oh, that's Ronke. Oh, nice. Ronke, hello.
Yeah.
Hi.
Hi. Okay, we have. It's still 7:03. I thought we would have. We're just waiting for a few more people to join us,
And I best
and
lock
then we'll
my door.
start. So we'll start
Before
in
I
one
have
minute
unwanted
time.
visitors. Okay. Okay. Yeah.
Maybe we should just start with your profile.
Okay. All
Yes,
right.
so I'll just read through Dr. Ann's profile. So I have with us here today Dr. Ann Lowu, who is a graduate doctor from the College of Medicine, Unilag, over 20 years experience as a doctor, and she's also a scholar of West African Health Organization, or ECOWAS, USAID, where she has a postgraduate internship in reproductive health and HIV/AIDS management. And of course, that is why she's the best person to talk to us today about sexual health and how to act
Thank
sexually active, or how to keep safe, have to practice safe sex, I guess is what we'll say.
you.
She's certified by the WIT Reproductive HIV and Research Unit from the University of Witwatersrand
Yeah, with
in South
water strand.
Africa. Yes. And she also has a master's in public health. Um, she is one of my greatest supporters at Healthboxes, and I met her through Newin. So anybody, if you're a female and you're looking to join a great women's network where you can form good relationships, please just check. You will see Enterprising Women Nigeria. You can follow them and you get good resources to help with your
Yes.
business.
Enterprising women for the win.
Yes. So would Dr. Anne, we just want to talk today, like I said, about sexual health. And the reason why this week we decided in health to do a lot more sexual health is because of the amount of calls we get with regards to questions which ordinarily I would have thought was um, was easily available information. So we thought, okay, if we do this, it would help um, people understand more, throw more light, more enlightenment about how to be sexually active, safe, and the things you can do to prevent STDs and all the other ailments that come with STDs. So my first question, and please, for all those that are joining, please, if you have any questions, please type it in, and we'll take those with us. And like I said, we're from Healthboxes. You can call us and talk to us, speak to one of our doctors with regards to anything that you might have some issues with. And we also have a lot of consultants as well that you can be able to discuss any ailments with. So, Dr. Anne, this is a question that comes in. It's very heavy on my mind because I am obviously female. And growing up, we didn't have issues around cervical cancer as much as we have now. And also, when we get a call, we have a lot of girls. When we ask them, "Hello, Okoye, nice to see you." We have some when we speak to some of our some of the calls, some of the ladies that call um, on when we ask few more questions about pap smears and when last they had a pelvic exam, they look quite shocked, surprised, they don't even know what that is. So can you just run us briefly what a pap smear is, why you should have it, and why you should check, and how often you should also check for?
Okay. Yeah, thank you. Thank you for that question, Lola. It's really important because cervical cancer is one of the cancers that is 100% preventable. Okay, and it's a gynecological cancer, and it's one of the highest cause of cancer deaths in women. And so everything that we need to do to prevent it is highly advocated. And how do we check for cervical cancer? Some will say cervical, some will say cervical cancer. How? Is by doing a pap smear test. And a pap smear test wouldn't take you up to 5 minutes, max maybe 3 minutes, and it's painless. Usually all you would feel is a pinch. And what does it entail? So there are different types, but basically when your doctor or health provider wants to take a pap smear, will usually use an instrument just to open up the genital opening. I want to be politically correct because I don't know. I'm just going to try not to use the main words if I don't have to, because of censorship. So that's why. And then, it's looked at. Sometimes they can just observe. So it opens up the vaginal openings. It opens up the vaginal tract. And then they're able to check the cervix. So sometimes under observation, the person doing the pap smear can observe and see. They can also do a staining. But a pap smear really means just some tissue from the cervical wall will be taken to be sure, just to find out if there is any abnormal change in the cell structure. I see Ajo has joined. Hello, Ajo, welcome. And Liz. So they just check to see if there's any abnormality, to the cells in the cervix. And we know that human papilloma virus is one of is the main cause of cervical cancer. So a pap smear really just helps to see if there's any change. And if there is a change, then if there's a change in the cells in the cervix, then something can be done quickly. And those changes can be removed, it's not something that is, the type of operation is not something that, is it's not a big deal. In court, not a big deal that can, if not, and that which if not done can cause a major health problem and eventually to death. So how often should a woman do a pap smear? So anyone from age 21 to 29, once every 3 years to do pap smear. And between age 30 to 60 to 65, yes, between age 30 to 65, once every 3 years as well. Or if you do a pap smear with human papilloma virus test. That's where a swab will be taken to check if there is an infection with human papilloma virus. And when that is done, then you can do, if you do a pap smear and an HPV test, then you can have that done once every 5 years instead of every 3 years. So again, I will reiterate. So if it's just a pap smear for women between 30 to 65, you do a pap test once every 3 years. However, if you do a pap test and an HPV test, then you do it once every 5 years. And aside the pap smear or the pap test, doing a what's it called now, a pelvic examination, just to check the overall health, of the female genitalia, is also very crucial here. I know we also have main joints, so it's once in a year, just once in a year. And when you do that, I would also say, I know that we're talking about sexual health, but what is really important is for you to have your overall health check. And then your pelvic check is one of them. So when I say overall health check, you're doing your blood pressure, your blood sugar, your cholesterol level, your mammogram once every 2 years if you're over 40 years, and also depending on your risk. And then also you can as well just check, the genital area, and also have a clinical breast examination done. So those are all the tests that you should do at least once every year, and not just having a pelvic examination done. And just to answer Ajo quickly, I see her saying, I thought it was every 2 years. No, really, what is advocated is once every 3 years, okay? But it can also, for the pap smear test, really. Now, for the mammogram, then we say every 2 years. And then it also depends. It depends on the environment. It also depends on your risk. But the general advice is once every 3 years for pap smear alone, or once every 5 years if you do a pap smear test and an HPV test. And now, if you're over 65 and you've consistently done these tests and it's been shown that you've always had a negative result, then after 65 years, then you don't need to do further tests for for cervical cancer, except you have an increased risk or there's a family risk and all of that. So I hope that answers the question.
Thank you very much, Dr. Ann. Now, you mentioned your age ranges started from 21. Yes. Now, a lot of people that fall are sexually active from, some as young as 15, but typically from course, Healthboxes, we start participation from 18. So what is the general, can you tell us more why HPV is an STD, and why, as soon as you're sexually active, you should be doing, you should be having your test done?
All right, so the reason why we say you wait till you're 21 is because two things. I'll talk about the HPV vaccine, okay? And then, but before then, let me explain why we wait till about someone is 21 before you do a pap smear test. So now so we know that one of the highest risks of cervical cancer is from human papilloma virus infection, okay? And it takes a while. It takes a number of years for that virus to cause changes to the cervical lining. And those changes will eventually now, predispose someone to having cervical cancer. So because of that length of time that it takes, by age 21 is when, it's all of this, based on general research and advice and recommendations. But in that, except for people who have specific risk or risk factors, and then they may have to start earlier, but usually it's always advisable from age 21. Having said that, what is most important for young people, for young females and even males, because we know that men are the main transmitters of HPV, and they as well are at risk of other cancers from HPV in future. And so, but we know that women are, more at risk because of the way our genital anatomy is. And so usually it is advocated for girls to have the vaccine taken before their first sexual intercourse. All right. And so that helps to prevent an infection from HPV virus. Unfortunately, we know that there are so many other, and this vaccine helps to protect against certain types of human papilloma virus. There are several of them, but the vaccines available are only able to, I think, cover for between 5 to 7, if I remember correctly, yes. So it doesn't cover for all the HPV. So that's why it's still advocated, all other preventive measures are still advocated. And that's why we say if taking an HPV vaccine, still, do the, what's it called, the pap smear test as recommended from, time to time. So that's it.
Thank you once again, Dr. Ann. So please, anybody listening out there, if you're sexually active, please go and get yourself checked. Go and check to see if your cervix is fine and healthy. And if you're thinking about starting to have sex, please talk to your doctor to find out about the vaccine, because you don't really know who the carriers are when you're meeting somebody new. And of course, you could also use a condom. So that is also a preventative measure. Now, because I see that there's some guys joining us, thank you, Alhaji Baba. I wanted to, let's talk about the men's sexual health now. We've spoken quite a bit about women's sexual, on the HPV side. We mentioned that the men are the carriers of this and they could also be affected. But a lot of calls we do get that have symptoms for STDs are from the men. So can you sort of run through quickly, not all the STDs, but the common STDs, gonorrhea, syphilis, like what are the symptoms that they should watch out for? And for the women that don't exhibit any symptoms, what should they watch out for? Right. And of course, use a condom. I'm going to keep saying use a condom every 5 minutes if I can. So, yes.
Yes. So, yeah, I see Ajo saying, please say where to get this support. Some cannot obviously tell their parents.
Okay.
I'll let that to help
Hello?
us when we're doing. Yes, hello, can you
Hello?
hear? I can hear you.
Yes, I can hear you now.
Okay, yeah. So, well, some of the symptoms that you see from STIs, usually, one of the commonest signs is a discharge. So for the men, they may have a discharge, a penile discharge. Can you hear me, Lola?
I can hear you. I'm seeing what New Wind is saying, and I have no idea how to pin the topic.
Okay. Okay,
so please bear
with
us. No, we would, yeah. No, keep going, please, Dr. Ann.
Okay.
Yes, so the topic is on sexual health. Yes.
Yeah, so try to pin it. You can do it from your own side. Pin it. You see something that will show you how to pin the topic. You don't know. Okay, so moving on. For signs of sexually transmitted infection. So for the ladies, it's usually very quite obvious some of the time, because sometimes that one of the signs is no sign. That the person is asymptomatic, nothing, no sign of an infection, and that's why it's very dangerous and why it can cause complications, in people further down the line later on in life. But usually for people who are symptomatic, we have different symptoms. For instance, as I said, discharge for the men or for the women, both for men and for women, depending on the organism involved. And sometimes it may just be a milky discharge. It may be odorous. It doesn't have any smell. It's just a discharge. For some people, they have the discharge and then they have itchiness. Some itch. Some people find that they have rashes, in their genital area. And I don't just want to shock us now. We have to be realistic that STIs are no longer limited to the genital areas. We have STI organisms affecting the mouth because of oral sex, and then the anal region because of anal sex. So all these things are quite important for us to know that sometimes the symptoms are from the mouth, sometimes they're in the genitals, sometimes they're in the anal region. So having said that, so we have for the secretions, which, you know, may be whitish, yellowish, grayish, yes, or sometimes brownish. Sometimes they may smell, they may not smell. Sometimes they may have a fishy smell. They may just have a bad smell. They may have a metallic smell. Sometimes it's yes, rashes that or blisters. For some people they would have blisters, like for herpes simplex, you know, sometimes they have blisters. So sometimes it's warts, like for HPV, human papilloma virus, is warts that they have. And for some people, for some of the STIs as well, there are different phases or manifestations of the disease. Sometimes for the initial phase, for something like syphilis now, it has 3 phases. Initial phase, you may find a chancre. A chancre is what you call like a wound. So it's like an open wound in the genital area. The genital area, that is the penis or around the vulva of the vagina, the anal region. For some people, it's even in the mouth. So depending on what route, you know, that the sexual activity is taking place. So these are some of the things that, so for syphilis, again, as I said, it starts with a chancre. And for some people, they don't even have that phase of the chancre. And it's self-limiting. The chancre can just resolve by itself, and then go on to later in the intermediate, and that happens after the 2nd to 3rd week of the infection. So for some people, they just go straight to the intermediate phase without a chancre. They just have weight loss, just general symptoms. They just have weight loss. They may have rashes on the sole of their arm and their feet. They may have fever. You know, so it kind of like maybe general. For some people, they would have lower abdominal pain. And then another, again, I forgot to mention, so for some people, some of their symptoms, you know, from STI is pain during sex. So during sexual intercourse, they may have pain. When they are urinating, they may have pain, some form of pain or the other. So that's another sign. And then for syphilis, as I was mentioning, then the latent phase, which is now where the complications come in. The complications including things like it can affect the brain, it can affect the central nervous system, it can affect, you know, the eyes, it can affect the heart, you know. So that's why we say that, you know what, it's not worth risking your life over. And that's just syphilis, you know. And another thing is STI, sexually transmitted infections, also increase the chances of having HIV/AIDS transmission. Increases the chances of an HIV/AIDS infection, HIV infection, or hepatitis infection, because the presence of those sores and irritation are open sites for other infections to happen if, you know, your partner is infected. So we always say protect yourself, because I know we get a lot of calls on from Healthboxes from people who are dealing with one sexually transmitted infection to the other, and that's a big deal. I mean, we have the rest of our lives to engage in any form of sexual intercourse that we like. So right now, that very one that you will have, make sure you are doing it safely. You are better to be safe than, you know, to live the rest of your life, you know, with battling with infections that you may not even know about. So that's why, you know, we always advocate that, you know what, use protection, use a condom, or make sure that you are with a faithful partner. But are you sure that you can know that your partner is faithful? You know, so those are some of the things. It's a whole lot. So I hope I've been able to answer that question.
Yeah, sorry, I'm just looking at the comments and they're making me laugh. So yeah, so it's quite funny. But so in Healthboxes, we get a few people who keep calling back with the same issue. They're having the same symptoms over and over again. They treated themselves, they've had the antibiotic course, and they're still having this infection. Maybe it comes back again, maybe after 3 weeks or so, and they're calling back and they say, no, I didn't get treated right. What causes that, and how can that be prevented?
Okay, so sometimes we have recurrent infections. One, it may be that the antibacterial, the antibiotic or the medication that was prescribed is not enough to deal with that infection. It can be because of what you call, I'm trying to remember, I'm trying to recall that scientific name, resistance.
Sorry, Dr. Anne, your internet, you're breaking up a bit there.
Oh, okay. So for some people, the reason why they have recurrent infection, is it still breaking up? Is it still breaking up?
Sorry, you were sounding like a robot.
Okay, I think maybe the internet was coming back.
So
can you hear me?
Okay, I think it's me. I've changed my
Okay.
internet.
Okay, yeah, I've seen it. I guess so too. All right, so one of the reasons why, I was trying to send a message. Okay, so one of the reasons why people have recurrent infections, there are so many reasons why people have recurrent infection. One of them is because of resistance to that particular medication that was given, the antibiotic or whatever it was that was given to treat that infection. And so usually, and then you know that for STIs, most of the time we do syndromic management. Syndromic management means that because of
I was
the
going to ask what syndromic management was.
So syndromic management is to pull the different symptoms that each person has. So because you cannot always do a lab test because of finances, for financial reasons, so WHO came up with this syndromic management. So you pull a number of symptoms from from STIs, from sexually transmitted infections, like the discharge, the itching, the pain during urination, the type of discharge. It can give you an idea of the particular organisms that cause that particular. It gives you an example, an idea of the organisms that may cause those type of symptoms. So rather than sending the patient to do a myriad of tests, you can just treat them according to their symptoms. Do you understand? I hope that's clear on syndromic management. So we manage the symptoms. Yes, yeah. So we manage the symptoms. So sometimes the drugs given may not, be working effectively. And we know that a lot of times now we have to be careful with the type of drugs the way we prescribe antibiotics, because people are abusing antibiotics and we are having a lot of resistance. And drug resistance means that antibiotic has found a way to adapt to that medication that you have given. And so it can still thrive despite, being given that the drug. So before it would have killed it and it would have taken care of the infection, but now it may not. So that's what we mean by drug resistance. So in that case, you may need to change the drug. You need to change the set of drugs that you give the patient. That's one. Another is the fact that for some people, they keep getting reinfected. And so you have a partner who has transferred the virus or the bacteria to you, and you still haven't, the partner wasn't treated or wasn't adequately treated, and you still had unprotected intercourse with that person. So there's no way you aren't going to get infected. So usually those are some of them. And then I always have to remember this. This is the age, there's no point being prudish and trying not to talk about something. This is the age where people use sex toys. And sex toys sometimes are passed around. Some people, well, it sounds ridiculous, but yes, but some people pass their sex toys around. So these sex toys, if someone who has been infected has used it, who has been infected has used it, and then you then go back to use it, I mean, that's cross infection right there. So that's another way people get, reinfected from previously treated infections. So I hope that
wouldn't they
answers the question.
Okay, that has just grossed me out. I'm sorry, I've never heard of it before.
Yes, there's so many
So,
things
okay,
to
so
do.
if you have sex toys, please clean them if you're going to share.
Yes,
So, clean them very well with, I guess, you can use methylated spirit to wipe it down.
soap and water.
Yeah,
Soap and
soap
water.
and water. Okay,
You did a
okay.
good job.
Um,
The
okay.
methylated
So,
spirit, I think.
how can men be? So we check themselves and be sexually healthy. You see what I mean?
Yes. So my first thing I would say, please use protection. STI is not written on the forehead. Sexually transmitted infections and other life-threatening infections, people don't write it on their foreheads. And even if you know your partner now, your partner is faithful to you and the partner is only with you, you don't know where the partner has been before then. And that partner does know where his or her partner has been before they met. So you may say, oh, you're starting on a clean state. But if you're starting on a clean state, have you done the test? Have you done all the tests that will help you know that you're clean? That you don't have any sexually transmitted infections, you don't have any infections, you don't have any life-threatening infections before you start with that new partner. And are you guaranteed that the new partner, is free of infections as well? So my number one advocacy is use protection. And when I say use protection, use a condom. Our men, our male, our men, please use. I don't know why they say that is no, it's not the same. I think it's about the technique. It's not about the condoms. Please, it's not about the condoms. It's the technique. Condoms will save your life and will make it, it will make you have as many sex as you want in future, so your health is important because people come with, different things in their penis. They have sores, they have warts, and it's very distressing. Their scrotum is swollen, they have water. It's really very distressing for those people. So rather than, put yourself through the rigor of having to deal with warts for the rest of your life, or herpes and rashes for the rest of your life, or even complications that may arise in future that are life-threatening, why not just protect yourself and also be faithful to one partner? If you have one partner, before you start and you are going to have unprotected sex, go for tests, do all the tests, ensure that you are good before you start doing the do. So that would be my advice.
The comments that were coming in and were talking, I couldn't hold myself. I'm so sorry for this. Is a serious topic. It is a very serious topic, and that's why we're talking about it. Reaction has been, yes. I'm sorry if
Yeah,
I
grossing
joke.
people out.
So, but generally for the male genitalia, how often should they inspect? And can they do it themselves? Do they have to go to the to the hospital to get it checked? I'm
Well, I would
sorry.
say, I mean, every day you wash, just check. We have our baths every day. If so, you need to get used to what your, and then that's what we also say for women. Know how your vagina looks normally. I know it's not easy for us as women. Take a mirror, look, and just know how your normal, Stop doing face. Stop giving us faces.
Because I've heard you say that before, and I have tried. And it's just so uncomfortable and strange to say the least. So,
I can imagine,
yeah.
yes. But
So
it's something
we
we
would
have to
all
do for
try.
our, yeah, it's
Yeah.
something we have to do for our health because you have to know the normal and get used to the normal. And that's what helps you notice when you see that something is amiss. And so for the men, I would say every morning when you are going to have your bath and you are washing, I mean, you wash your penis, check and just look, lift it up, check your scrotum. Oh, everything is fine. We are all good down there. And for women, you know, you may not be able to do your own every day when you are having your bath because of the peculiarity of, you know, of our bodies. But yeah, it's still worth your while, maybe once every month or once every other month, you know, just like we do our self-breast examination. That's why it's just as important. And then for women, I may say, I know we are still going to talk about vaginal discharge for women. It's always good to smell yourself. It may gross some people out, but it's good too, because when you do, when something is at me when something has gone wrong and something is not right, and you are seeing that, you know, the vaginal discharge is different this time, you know, and then you can do something about it. Because even for women, some people don't catch the symptoms that they have from sexually transmitted infection, and it is worse with women because over time, if sexually transmitted infections are not treated, it can go on to cause pelvic inflammatory disease, which can go on to cause infertility later in life. Or even for mothers who are, for women who intend to have children, it can go on to cause, you know, birth defects in children, or, you know, during when you're giving birth, it may, if the infection is passed to the child, it can affect the child one way or the other. So it's important to always know yourself and know your body and know the signs. Yeah, someone says yes. Yeah, Ronke says it's good to smell yourself. Absolutely. Yeah, thumbs up to that.
Thank you, Doctor. And I hope somebody is learning something new here. I mean, I'm definitely learning something new. And I hope to pick some good habits after this. Now, I think if we go on, so we'll lump the last set of questions together. So you had touched on the vaginal discharge. We've talked about it. Now we get a lot of questions with people saying that these are now mostly women, that they have pain during intercourse, that it's dry, they're not lubricated enough. How can they improve that? Are there any foods out there that can help, or is there? So my pastor's wife swears by ewedu and amala. I don't know how true it is, but she swears by ewedu, that ewedu helps. So that's why I mentioned the food. But what other things can be done if, for example, you're not wet enough, I guess, before penetration?
Well, I'm not a sex therapist, but I can tell you what I know what works. I can tell you what I know works. Okay. Is not rocket science for women who are having painful sex. So if we eliminate that there may be a problem, that there's no STI, so we know that sometimes sexually, when there's an infection, ongoing infection, there may be pain during, Ajo says exercise. Yeah, thank you, Ajo. I agree. Yeah, but I'll go to the exercise later. But yeah, even though I know that, so if we remove the fact that there are no infections, and we remove the fact that there is nothing wrong with the cervix, you know, no tumors, no inflammation and all of that, then we can say, okay, what are the things that can cause painful sex? Ajo has said, oh, that can relieve painful sex. Ajo has mentioned that exercise works. And I agree. Exercise, no, yeah, you said you're joking, Ajo, but I believe that it really does help, because it helps you to be more flexible, you know. And if you are more flexible, then you can move better, you know. And I think with movement, lubrication is better. But one major thing with painful intercourse is lubrication, lack of lubrication. Many women are not lubricated when, you know, when they are in maybe sometimes it may be because, you know, they're just not in the mood and they just want to give their partner the go, you know, just get on with it. And so your mind is not there. So if your mind is not there, those hormones that needs to be released for you to have the secretions that will make you wet, they would not be released. And if you have a partner who is not gentle, who is not patient, and sometimes some people are just not patient. They just want to just get in and be done. And that is a major avenue for, I mean, that's 100% most of the time will cause painful intercourse. So I say do everything to make sure that the lady is wet and ready before you start. Another thing that we can use are lubricants. So we have different types of lubricants. Remember, I'm sure that for most people who are not who are not married and who would like to have, I mean, who would not want to get pregnant and would not want to have infections passed, you're supposed to be using a condom. So there are different types of lubricants that you should use. So I would not advise for you to use water or oil because those ones can break the condoms. But we have KY jelly. Almost everyone knows KY jelly. And then some condoms also come extra lubricated that, you can use, and that can help with, getting your partner to be moist. So I hope that helps.
What what we call toilet disease? So a lot of people call and they say they've had, they have frequent urination, and it happens when they fasted.
Okay, so the toilet disease, what I know of toilet disease is usually yeast infections, candida, from candidiasis. And it's said that about 70% of women worldwide would have experienced one form of candida infection or the other. And usually a lot of people also have it recurring. Usually candida disease is not, it's not a sexually transmitted infection, but you can still get it from your partner if your partner has it. But it's just also, there are other factors that cause candidiasis. And some of them are antibiotic use, if you've used antibiotics, because, so the body has a way of getting, rid of bacteria by itself. And that's why we have vaginal discharge. I think I should talk about the vaginal discharge a little more later. Yeah, so if we have the time. But, so the body takes care of it. But sometimes when the pH of the pH or the environment of the vagina changes, then it can leave room for an overproduction of candida albicans, which usually normally it should be okay and it should be normal. But once the pH there changes, then it can overgrow and cause all of that itching and the burning and the cheesy, cottage cheese-like secretions or vaginal discharge that most women have. And so when you use antibiotics a lot, it can cause that. If you are stressed out, because that can also, change the balance down there, it can cause that. If you are using hormones, if you're on any hormonal therapy whatsoever, corticosteroids, steroids, or you always use a lot of steroid in your cream and all of that, or you wear, you're always wearing tights. I hear people, they wear, these days now we all want to look our best, we want our tummy to be firm, our thighs to be firm. So we use a lot of all these tights and body shapers and all. And that causes a lot of moisture there, and it can change the pH of that area. So it makes people come down with that. And so when they get treated, people still come down with with the infection after some time, because the habits are the same, nylon or nylon underwear, and hygiene generally. And then sometimes for women, if we clean from the back to the front rather than from the front to the back when we've had a go, so those things also can cause recurrent candida infection. So those are the things that cause it. So to avoid having it, avoid doing those things. Another thing that has been said to be helpful is when people use probiotics. But for us down here, I would say easy thing for you to use, go get yogurt. I mean, 100% yogurt, not the sweetened ones, not the ones, I don't want to mention a particular company now, but go look for farm fresh yogurt, real yogurt, and take it from, especially if you've taken antibiotics. I mean, just to restore, the normal flora.
Bacteria.
Just take some yogurt. Yeah. So that's it. So that's about.
So before we run out of time, can we quickly touch on contraception? So when I say contraception, the different types, how the men can help the women and how the women can take control
Okay, so I will,
of the
so with
contraception.
contraception, I know we know there are different types. There are the reversible and then the reversible types. But I will first start with condoms before we run out of time. Very importantly, please, men, because women complain that, oh, we're not castigating men, but women complain that, oh, my partner doesn't like to use condoms. We've already talked about what happens, why some people don't use condoms. If you are using it right, then, I mean, your pleasure would even increase because it would even help with what we call the lubrication, because some of them come with, lubrication inside. So please, it is very important that, you protect yourself, because you are protecting when you use a condom for the males. It's the easiest thing to use outside abstinence. I would say it is the easiest thing to use. When you use a condom, you are protecting yourself from not just STIs, sexually transmitted infection, life-threatening infections like HIV/AIDS and hepatitis. Then you will also have peace of mind. You will not need to go and do a DNA test sometime down the line, your partner gets pregnant and then all that trouble, not to now talk of you not being ready for pregnancy. So even for married people as well. So it's very important. It really saves you a lot of heartache. Just what you should do is master the act of using condoms. Condoms are okay. So that's being said. For other methods of contraception, so we have, like I said, the reversible and the irreversible. The irreversible ones, the ones that cannot change once you've done them, are the tubal ligation, where the woman can have her tubes surgically nipped and cut and then tied so that her eggs can, during ovulation, cannot travel down to the uterus, to meet the sperm. And for men, is vasectomy. Vasectomy as well, what it means is to, and I know that a lot of men don't like to hear about this, but I don't know why, but women do it. So what's the big deal? All it does is, it does not stop seminal fluid from coming out during intercourse. All it does is it stops the sperms from getting, out. So it blocks, so you are cutting out the duct that transfers the sperm and not the seminal fluid. So I don't see, it's not a big deal really. So let's go back to the other ones. We have simple things like vaginal rings that have hormones. So we have the hormonal and the non-hormonal. So I'll quickly go to the hormonal ones. The vaginal ring that a woman can place up in her vagina for a number of weeks, that will be releasing hormones. Then we have sponge. Sponge are things that you can also put up into the vagina to cover the cervix, and usually those sponges, they contain spermicides, so it will kill the spermicides, after intercourse. You have to have placed it before intercourse anyway, and then keep it there for a couple of hours, maybe about 6 to 8 hours, to ensure that nothing leaks. And some people will combine the sponge with spermicides. So spermicides they just kill the spermatozoa that has gone in. So that's that. And then we have cervical caps. We have diaphragm that can cover a woman's cervix, and prevent the sperm from going up. So those are some examples. And then we have so we have the no plant. No, I won't say no plant. No, I mean the implants, because no plant is a product. The implants where people can, and it usually is under the arm. You won't even know it's there. Usually an incision is made and it's put there. It's like a rod, a very tiny rod. It's not even half as thick as my hand. And then so it's inserted and it produces hormones from time to time, probably once a day for a couple of 3 to 6 years, depending on the type that you have. And that can prevent pregnancy. How do these hormonal contraceptives prevent pregnancy? So they prevent the woman from ovulating, or they make the sperm, they make the cervical lining and the vaginal lining uncomfortable or impenetrable for hostile, rather, not impenetrable, make it hostile for the sperm released to be able to get to that part of the uterus where the egg has been released, if an egg is released. So that's that for the implant. And then we have the hormonal IUDs, intrauterine device. The intrauterine device, we have copper T, and then we have copper T is the non-hormonal one, intrauterine device that you can place And so your doctor will put it in through the vagina, and then it goes on through the cervix, and then it closes up the uterus such that the sperm can go out and the eggs can go usually to meet up with the sperm to cause pregnancy. So those are those. And then we have the injectables that you take maybe every 3 weeks. For some people, it's every 3 months. So there are different types and there are different formulations. Have I missed out anyone? So we have the female sperms as well. The female condoms rather, but that's really gross. I mean, if you see it, you're like, wow, how am I going to use this? Which is quite daunting, to use. And then you need some skill to be able to know how to place it and how to remove it after intercourse so that, it doesn't spill back. And then we also have now the natural method. Now, the natural method, which is another method of contraception, but you have to be diligent to know when your safe period is, when you have ovulated. You have to know, some people, along with knowing when their ovulation is, they use their body temperature, and then some others also use their the vaginal discharge, the mucus that is secreted, to know the consistency, whether it's stretchy or milky or transparent, to be able to know when they should stay away, because, they can get pregnant for that season. So quickly, that's sums up.
Okay, so this will be the last question, because I think we've been here for about an hour. Thank you all for keeping with us. But can we, Postinor, can we talk about Postinor?
Yes,
and round up on Postinor and its use.
Postinor is not a regular form of contraception. A lot of people miss it. It is called emergency contraception for a reason. That is emergency contraception. And in fact, Postinor is not the only way of preventing pregnancy if you've had an accident, when I mean an accident, you had an unplanned intercourse, and then you need to protect yourself. You could also use copper T. You can go to your gynecologist and say, please, I need you to insert copper T for me, and it will prevent pregnancy. That is, if you're able to do it in less than 72 hours of it happening. Now, Postinor is not advisable for you to use over time, recurrently. Why? Because it will mess up, your hormonal, the normal hormonal balance. It will mess it up because,
they're supposed to. Sorry to interrupt, because I just want to stress, you're supposed to only use one dose per month. So we have people calling Healthboxes, and they used it maybe every single time they've had sex that month. So they could have used 10 doses in a month. So it's one every month, so that you have to find something else.
I would even say, if you are using one every month, then you are doing it wrong, because you shouldn't. It is not a permanent, because if you're using one every month, that means it's no longer emergency contraception.
No, I'm not advocating for it to be used one every month. I'm saying that's the maximum.
I'm addressing it. Yeah, because some people can swear by it. They say that is what they use. And then after they complain that, oh, my period doesn't come regularly, my body is always feeling somehow. It's because of the Postinor 2 that you are using. So if you have to use Postinor 2 every month, then go and use proper contraception. It is important because, somewhere along the line, you want to achieve fertility down the line, and you don't want your hormones to be all messed up and your body trying to find out, so what are we going to do today? Is Postinor coming in? Is it? So that's what happens. And then also, I need to mention that it is most effective, that's the emergency contraception, when you use it in less than 72 hours of intercourse. And the earlier you use it, the better. If you use it in the first 24 hours, you're more likely to be successful to prevent pregnancy than, after 48 hours, after 72 hours, and thereby. But again, to mention, Postinor or emergency contraception is not your only means of emergency contraception. Just go ahead and have a copper T inserted and leave it there. And you have contraception for as long as you need it, at least for the next 5 to 10 years, depending on how long. And that doesn't cost you any, side effects. The side effects that recurrent Postinor intake will cost you. So
Okay,
this
so we literally have 10 seconds more. So I just want to take the time to say thank you very much, Dr. Anne.
yeah.
The comments have been hilarious. Thank you also for everybody that's participated.